So today we're going to talk about the introduction to exercise with cardiac rehabilitation and getting the heart nice and strong. I've got my good friend Des here, who's going to be our patient today. We're going to talk about how to warm up, do some stretches, then get into the exercise component of the program and finish off with some cool down and stretches to finish off. So to start with, Des, what we're going to do is we're just going to exercise at a comfortable rate just to get our system ready for the more intense exercise later on. So to start with, just start with some gentle walking on the spot. So what we're looking at is just to build your confidence with the program, build your confidence into getting some regular exercise happening. So what you should be feeling is just the ability to still have a conversation with someone while you're exercising. If you start to feel laboured breathing or you start to feel any chest pain, arm pain, jaw pain, any of the cardiac symptoms, then these are the things that we want to generally be aware of, not worried about, but aware of, so that if you do start feeling that, you can just settle down, recover, and especially for any of those cardiac symptoms, seek some further advice straight away. So we'll be doing this as a warm-up for generally about 5 or 6 minutes, but we generally, as we go, we start to develop a little bit more intensity, as much as you can tolerate. One of the big things with exercise is your technique. So if any of your exercises you're straining that hard that your technique is failing, you've probably done too much. Doesn't mean not to do the exercise, it just means to back off, have a rest, and then start again. How are we feeling?
Fine, thanks.
Yeah, still talking and walking?
No problem.
Excellent, excellent. So from here we might just gently start to move into a little bit of a gentle jog on the spot. So one of the things that we need to be aware of with a lot of patients is that they may have other comorbidities, such as orthopaedic injuries, sore knees, arthritis, these sort of things. How are you going in that department? Anything we need to be aware of today?
Nothing too serious.
Nothing too serious? So that level of activity is still going to be so that we could have a general conversation, even during this warm-up and this little bit more intensity. So again, if you can't talk to the person next to you, if you can't talk to someone else in the room, then you generally want to just back it down a little bit and go back into a walk until you can do that comfortably. So for people that do have general aches and pains, such as arthritis, a water-based activity can be quite nice. Take some of the pressure off the joints while you're doing it, or gentle cycling on an exercise bike would be a good alternative.
No problem.
So we're going all right?
Going all right, yeah.
Breathing normally?
No problem.
Good. Okay, so let's just ease that back to a walk. Good.
Yeah,
A little bit of sweat on the brow. You'll be looking forward to that later. It's good. So we generally want to also be quite wary of both your heart rate and also how you perceive that you're exerting yourself. So there are different scales out there or different measures that we can use to give you an idea of how hard to work. Certainly heart rate is very important. Some people are on medication after a cardiac event or after cardiac procedures. So for those people, and for anyone, another good measure is just how you're feeling at the time that you're exercising. The measure that I've spoken about so far is being able to carry on a conversation while you're doing exercise. So that's one measure, the talk test. Another one would be your perception of exertion, which has a term called the Borg scale or Borg score. We use 1 out of 10, and generally we want you working at about a 3 to 5 or 4 to 6 range out of 10, which would be being able to carry out a normal conversation. So,
right.
Okay, now if we had steps in here, what we'd be doing right now is doing some step ups. So all I want you to do is just step forward as if you're stepping up onto a step, and then back again. So forwards and backwards. Forwards, backwards. If you had any issues with knee soreness, this would be something that we could simulate just by, as we're doing now, stepping forwards and backwards rather than up and down. So you're not putting that transference of weight through the joints and creating more pain at the knee joint.
Right.
It's important if you're going up with one leg all the time to switch it over and start with the other leg. Good. And we'll go back to just a gentle jog on the spot again. So obviously for people who haven't done a lot of exercise before, the first time in can be a bit daunting, but the benefits are always going to be there at the end, and you're probably going to see them evolve as your fitness evolves. So you're going to feel much better after exercising as far as the release of endorphins, so you feel happier, you feel that sense of accomplishment. You can also get a little bit more motivated to do other things, get involved more socially, become more active as far as having a walk with friends and family, walking the dog, all of these sort of things. So if you can try and take that sort of positive approach, you're going to be more motivated, you're going to get more out of it at the end. So those are psychological things, you feel happier. The other aspects are obviously physical. So you're getting the general cardiovascular strengthening, so your heart's getting stronger, your blood vessels getting more able to pump the blood around the body and to clear all your waste products. But you're also getting strengthening of all your skeletal muscles. So you're going to get much more, I suppose, capability to do other functions of your daily life. Okay, so just stop there. Just keep walking on the spot. What we're going to do is we're going to stop and do some stretches. Okay, so when we do stretches, now that we're nice and warm, we're going to do stretches of all the major muscle groups that we're going to look to exercise when we get into the exercise component of this. So part of the warm-up, always a good stretch. So we'll start with the upper body. Okay, so arms first. So what we'll do is start by just pulling one arm across the other and pulling back in and stretch all the back of the upper body here, all your arm, and try and maintain so if you're not twisting your body so much, so we're getting just the arm here at the moment. Okay, so you should be able to feel that just in the posterior shoulder capsule and down the back of the arm here. Great. With our stretches, we'll hold them for about 20 seconds, at least 20 seconds, so that we're getting a sustained effect from the stretch. Okay. So you shouldn't feel any pain on stretching. If you are feeling pain, maybe just drop it back a little bit, but still do the stretch. Okay, it should be just a nice pulling, nice stretching sensation. So you can just relax and then bring it up and go the other arm. So again, just a nice hold and relax. Okay, just shake that out. Good. All right, what I want you to do is just place your palm face up, bring your other arm on top, grasp your fingers and pull them down. So you're stretching through the front of your arm now. Now you can get a greater stretch by moving your arm down and remaining upright. So this will be stretching out your biceps at the front of the arm and also the nerves that run down through the front of the arm here as well. We'll get a nice little stretch. Shake it out. We'll do the other hand as well. Great. Okay, just for triceps, what we'll do, triceps the back of the arm here, just reach over your head, grasp your elbow and pull down behind you. So we're just getting that nice downward stretch there. Beautiful. Feel that all the way down through here. Still comfortable?
Yep.
And relax. And switch arms. So while you're doing your stretches, if you're starting to feel like all your upper body, you're getting nice and warm still because you've been doing your stretches and your warm up. If you're starting to feel that your lower body's getting cold, just move from side to side, keep yourself moving, keep yourself supple. Okay. Next one we're going to do is going to be a stretch for your quadricep muscle, so your thigh muscle at the front. Now you might actually find that you need a little bit of balance help for this one. So all I'll get you to do is just bring the chair in, and you can stand hold on to the edge of the chair. Now we don't actually want you pushing down on the chair, so we don't want you to tip the chair over, okay? So a bit of pressure just here for support. Bring your foot up to your hand, keep your bottom tucked in, and try and keep your knee adjacent to the other knee. So bring it in nice and tight. You feel that at the front of the leg there?
Certainly can.
Good. And then the other leg. So it's there just for balance. For good reason too. Very good. So shake that out, bit of a stretch. We're going to work on the muscles at the back of the leg now, give the hamstrings a bit of a stretch. With any of these exercises, because we're holding for time about 20 plus seconds, we want to make sure that you're maintaining your breathing through that as well. So try it where we can, making sure that we're not holding our breath. Holding our breath is going to build your blood pressure up, so we don't really need that happening either. So all I want you to do is just stretch out, heel on the ground, and I want you to lean into the stretch. So you can have a hand on your thigh to support yourself if you want. And what we're going to be feeling, with that leg straight, that you're going to be getting that stretch right at the back of the hamstring here. So again, the chair's there for support if you need it. Now with the stretches, what we want to try and do is maintain a nice, slow, solid stretch. So we're not bouncing, we're not doing any of that, it's just a nice, slow, solid stretch. Now some people might feel what they term neural tightness or nerve tightness behind the knee. Okay, if that happens, instead of pulling your toe up, you can actually push your toe forward and you might feel it more in the hamstring. So just play around with that as well, either toes up or toes down, but we really want to get the stretch in the back of the leg and the hamstrings there. And then we'll do the other leg. Yeah, so the more you lean forward, the more you're going to get into that stretch as well.
Right.
That's it.
Oh yeah. That makes a difference. Ooh.
Got the right leg moving? Okay. How you feeling? All warmed up?
Yep, good.
Okay. Just got a couple more to do. So we're going to get down on the ground for this one, but just into a sitting position. So if we can get down, what I do is just stretch out the muscles in the inside of your leg here, just into your groin. So we're just going to try and bring your feet together. If you can't, that's fine. They can be apart. It's whatever's right for you, whatever your level is. But if you can bring them together and bring them up as far as you can, so it's just a comfortable stretch in the groin, and then use your elbows just to push down into the knees.
Okay.
Comfortable?
Yep.
Breathing?
Keep breathing, yes.
Breathing's good. Breathing's important. Very good. All right, last one before we get into exercise, just a calf stretch. So just stretching the muscles in the bottom of your leg. So that's right, so we're just going to do a bit of a lunge.
Yep.
You're just going to feel the exercise's stretch is going to be in your calves. Got that?
Yep.
So one of the things that I see a lot of people make the mistake of is when they're doing these exercises like a calf stretch or even a hamstring stretch, is they narrow their base of support. So they almost do it as if they're on a tightrope.
Oh, okay.
Do you imagine you're on a set of train tracks? One foot on one foot on the other.
Yep.
Okay. And the other leg. It's impressive noise. Okay, let's shake that out. Feeling all right?
Yep.
Okay, so we'll get into the exercise components. Just put these chairs back behind us a bit further. Just move that one out of the way. Okay, so again, we're going to start with some running on the spot, build that back up. So we're going to have to keep an eye on how we're talking to each other as we go. All right?
No problem.
We're just building up a little bit more intensity now. So intensity can be increased by either increasing the amount of steps that you're doing per period of time, or by doing things such as lifting the knees up higher. So just do some with high knees. How's that breathing going? You still talking to me?
Yes, no problem.
Okay. Can you carry on a conversation?
Well, I could try.
Okay.
That's
So
right.
if it's getting too much, then we just lock it back down a little bit and go back down into jogging. Just so that we can recover our breathing. And a really good way of to set out your exercise component is to do some cardiovascular work, so some of the running or cycling, these sort of activities, and then combine that with some resistance exercises. So resistance exercises might be lifting cans of baked beans, it can be anything you like. Okay, we'll show you some of those. All right, so in addition to running on the spot with knees up, we can always do heels back. So just and again, if the communication starts to labour, then we just lock that back a little bit more.
Yep.
And go into gentle jogging on the spot. How are we feeling?
Yeah, good.
Okay, back to some gentle jogging. It's recovery jogging. See, it's making you feel better already.
It's all right.
Okay, we might do the first of our resistance exercises. All right, so just grab your chair again. All we'll get you to do is sit down. It's a great resistance exercise. What we're going to get you to do again is to stand back up. So if you can do it without using your hands on the arms of the chair, then do so. What we'll start with is hands on the arms of the chair. So standing up, and back down. Standing up and back down. So it's a really good exercise because it uses all the major muscle groups from the waist down.
Right.
Okay. So you've got your glutes, quads, hamstrings, calves, all working. Excellent. So really good with basis support, so your legs are shoulder width or thereabouts apart. And again, we do probably sets of 10 to 20 in our regular groups, or until technique tends to fade, technique tends to fail, and then we'll get back into some more exercises. How are we going, all right?
Yes, no problem.
How's that knee going?
Yeah, still there.
All right. So just while we're sitting here, I want to try same thing, but this time without using the arms of the chair. So from here, try not to push up from your legs. So hands out in front, hands across the body, whatever's comfortable for you, and then standing up. Good. And with the exercise, with resistance exercises, the technique is more about doing it slowly and controlled. If you do it quickly, your technique tends to fail. So an exercise can be taken over 3 to 4 seconds. There's no great rush with it. Mm-hmm. Your heart rate's still going to be working. Okay, so this is not necessarily recovery time for your heart rate, but it's exercise time for specific muscles.
All right.
In fact, the slower you go,
Harder it is.
the harder it is. Excellent. Well, I think that was enough sitting down. We'll put these back. Now we'll start again as if we were going up on our steps. Okay, so stepping up and back, up and back. No problems?
No problems.
And back to some gentle jogging on the spot. Very good. Feeling all right still?
Yes, man.
Great. Okay, well, we've done some lower body activities with the resisted work on some upper body activities. So what we're going to do is we're going to work on bicep curls. So you can use some hand weights or you can use some cans of baked beans. You don't have to use anything. It's more about the action. So what we're going to do is merely bring your clenched fist from a position of down low to up high. So you bring it up towards your shoulder. Okay, so keep your arm fairly steady by your side, maintain yourself in an upright position, breathing while you do it, lots of cues here, and then bring your arm up and down in a nice controlled manner. That's it. So the temptation can be, especially if you've got a resistance weight, so keep going with them. The temptation can be to use momentum to throw your arm up and then to lower it back down. What we want to try and do is maintain really good control of the limb through the full range of movement. So it's important not just to exercise where it's comfortable, which is usually here in the middle of the range, but at the end of range at either end. So down low, all the way through to up high. Excellent. If you exercise one side, you've got to exercise the other. Good, so try to reduce the swing through and be just more straight up and down from here. Brilliant. And again, with any of our exercise sets, we probably try and do 10 to 20 repetitions of any of these exercises as long as the technique is maintained.
Right.
And if you were to have an injury in an arm, for example, you'd just do more of the leg exercises or reduce the resistance that you're actually doing with that arm. Okay, and same with the leg. If you've got sore knees, do more upper limb exercises and work around it. Doesn't mean not exercise. Okay, great. So we're about getting into our program now, we're a bit warmed up. So what we'll do is we'll just see how hard you're working. Okay, so there's a couple of ways that we do this. Obviously we can measure your heart rate. We also look at how you feel that you're working. So we've looked at the talk test and being able to carry out a conversation. How are you feeling that you're working at the moment? Hard, somewhat hard, moderately hard?
Moderate, yeah.
Yeah, so if we had to give you a score out of 10 as to how hard you're working at the moment, how hard would you say that you're working?
At this very moment? Or
When we're doing the exercises?
probably 4 out of 10.
Okay, so that's what we're sort of aiming for, is between 3 and 5 or 4 and 6 thereabout is a really good level to be exercising. Back that up with a bit of something that we can measure, which would be your heart rate. So it's something that's easily measurable. The hardest thing is finding it the first time. Once you've found it once, you'll find it always. So the idea is just to come straight down from the thumb, straight down next to this big bunch of fibres in here, and just with 2 fingers, not your thumb, 2 fingers, just rest naturally and comfortably in that little groove in there, that little fossa. You can pick that up straight away. So you have a go at that. You can count that. Okay, so we'll give you a chance to count it, and then I'll count it and make sure that we get the same result. We've got a clock that we will actually go on, which will be for 30 seconds, and then we'll double that. So go. And stop.
46.
46, so we double that, 92 beats per minute. Now a really good way to work out how hard you should be exercising is working out your maximal heart rate or your predicted maximal heart rate. Now there's a formula for working that out, which is 220 minus your age, if you don't mind us
60.
going that way. So 160 beats per minute is your predicted maximal heart rate. And we're probably looking to exercise between 60 and 75% of that for a moderate workout. So 60% of 160 is going to be about 96 beats per minute, so we're doing pretty well.
Good.
So while we're going on with that, you've got one measure, heart rate. We've got another measure, your Borg score. So that's out of 10, roughly how you feel that you're working, your perception of exertion. So on both those accounts, we're about right on the money. If you're working too hard, again, go back to just having a bit of a walk on the spot, wait until you feel like you're more comfortable, and then go back through with it. No chest pain?
No.
No nausea, dizziness or anything like that?
No.
Then we'll push on.
Great.
So I'll get back into some jogging on the spot. I've got a bit of a glow up as well.
It's a sign of health, isn't it?
It is.
Yeah.
It's making me feel happy. So you don't have to work hard to get a benefit. Okay, just enough to raise the heart rate. You're going to get a really good benefit out of it. So we've done a lot of forwards and backwards work with the step ups. We're going to envisage that we have a step next to us. We're going to step up onto the step and then down.
We need some music.
Oh, we do. Actually, music is a really good thing to have going while you're exercising. If you're listening to music while you're exercising, the beat that you listen to is important. If you exercise to something that's too rapid with the beat, you'll actually work harder, and that will actually increase your heart rate, maybe into an area that is unsafe. So pick and choose the exercise music that you listen to. But exercise music's very good as well in the fact that it can distract you from other things, such as creaky knees. So if you were to do exercise listening to something and listening to it loudly, it doesn't need to be that fast, energetic gym music, but it's something that you're particularly, comfortable with, it'd be a good distraction. You actually get more of your exercise. You're likely to exercise for the entire CD of something you like listening to,
Yeah,
rather than to nothing at all.
that's right.
Okay, well, it's about time we went back down and worked on these lower limbs again. So we've done some step ups and we've done some sit to stands. What we're going to do next is some lunges. So what we'll do is we'll take the front foot forward forcefully, but not to the point of giving you any pain. Remember your train tracks, so feet shoulder width apart, and you're coming forward. You can have your hands on your hip for balance, but you're coming forwards, putting weight through that leg, and you should feel yourself taking the weight through the quadriceps. Yep. Mm-hmm. So do 10 on each leg. And remember, slow and controlled. Excellent. All right, let's do the other leg. All right, there you go. Now you might find if, for example, you did have a sore knee, instead of going down all that way and getting all the way down low, you don't have to. Just come to where it's comfortable for you. So it's a smaller step and more comfortable, then that's fine. You still get a benefit from the activity. Excellent, just walk that off. Back up to a bit of a jog. Feeling all right? Comfortable?
Yep, feeling good.
Good. All right. Some more upper body work? Absolutely. Yes, please.
Absolutely.
Okay. So if you've got a can of baked beans again and you've got some sort of hand weight that you can hold, you can either do this next exercise with both arms together or one arm at a time. I'll show you the technique for both. So it's to work the triceps that we stretched earlier. So with a weight or even just with your hand, reaching up over your head, straight above your head, it's like you're scratching your back basically. So you just bring your back scratcher straight down your back and then back overhead. So controlling the movement. So nice and slow. So this is for unilateral or one arm at a time. If you've only got a weight that you were using for your leg muscles, for example, or a larger muscle group, you might not be able to hold that same weight and do this, in which case you could have both hands around the weight and do both arms together. So coming straight down behind you and then straight up. So nice and slowly, as if you're pushing straight up. That's it. Beautiful. So you don't need to lock your arms out at the top if that's uncomfortable. They only need to extend up above your head and then back down. Great. Good. And then if we exercise that one arm by itself, the right arm, we better do the left arm as well. Good. No problems?
No problems.
Been doing a lot of running on the spot. It's good for keeping your cardio up. But if you've had a leg injury, you might need to do something with your upper body to keep your heart rate up. So you can do that with different techniques. One of the ones that we like to use is shadow boxing. So if we just get into a nice comfortable stance, so feet just wider than shoulder width apart, knees slightly bent, focusing on your tummy being nice, your deep tummy muscles being nice and tight, so you've got a good upright posture. We don't want people ending up leaning over. So just like this, and from this position here, just gently just pushing out in front of you. Just gentle little punches out in front. But it's a really good way of using muscles that you don't usually use for cardiovascular exercise. And the faster you go with that, the more intense aerobic workout you're going to get. So it's going to be harder on your breathing. So we just want to do what's right for you as an individual. And remember to breathe. Comfortable?
Good. Yeah, very comfortable.
Yep. Still got a bit of a glow up? Feel like you're working?
Yes.
It's important with any of these exercises as well that you do know your tolerances and your limitations. So if at any stage you need to stop and have a drink of water or a bit of a rest, it's important to stay hydrated as well. So sing out.
No worries.
Okay. We'll do another exercise for your lower limbs, strengthening exercise. What we're going to do, we'll grab the chairs again, just for balance. And just have that, facing me. What I want you to do, stand again with your feet about shoulder width apart. I want you to go up onto your tiptoes and then back down, but don't actually allow your heels to touch the ground. So we're exercising the calf muscles at the back of the leg here. So if I was doing that in this direction here, I'm going up slowly onto my toes and then slowly down, but not allowing them to touch the ground. So it's about controlled movement. And back down without touching the ground. So there should always be a gap underneath. Mm-hmm. Some people will get sore doing that because it's quite a vigorous workout for the calf muscles. If that's the case, then certainly come back down and have a brief rest on the ground. But better if you can, for muscular strength, maintain that gap between your heels and the ground. Does that make sense?
Yes.
Now the advance of that is obviously to be doing that exercise, but doing it one leg at a time. So with that one, you can either hook your other leg around the back or have it next to, but going up onto one leg and then back down. One of the biggest obstacles to overcome with this exercise is the balance.
You're not wrong.
If you do one leg, you've got to do the other. So nice and controlled. If you can't push up in a controlled manner, just lock it back down, have a rest, have a bit of a walk out. Try again. If that doesn't work, go back to 2 legs. It's only what you can do with excellent technique. Very good technique doesn't cut it.
Okay.
It's got to be excellent. Okay, so they'll tighten up those calf muscles. So we go away from the punching for a second and get back to just doing some gentle jogging on the spot just to loosen them up. So it doesn't have to be a vigorous run, it's just what you can tolerate.
Mm-hmm.
And again, if this isn't challenging you enough, then you might throw in the high knees or the heels back, as we went through earlier. So we're getting through, we've got a couple more exercises to go in this example of some exercises. So to start with, we're going to just finish off with our bit of jogging. We're going to work some more on the upper limb again before going through the lower limb to finish off. So the last one for the upper limb we're going to work is the shoulders. So for the shoulders, all we want to be doing is having your arms up next to your shoulders here and pushing straight up to the ceiling. So again, you can hold cans of baked beans or anything. You can get some little dumbbells from your local shop. Straight up to the ceiling and nice and controlled again. So it's not a big push, it's just a controlled movement up and slowly down. Up and slowly down. Good. Now again, if you had a sore shoulder, for example, or you had limited range of movement in this, in one arm or not the other, work one arm at a time, pushing up to the ceiling and back down. You can support the arm, you can assist the arm. It's about doing the exercise. Good. So we'll go to the rest and we'll go back to doing some more aerobic work. So again, away from the running, we'll go back to the punching again, just to get the blood coming back through our arms because it's been up in the air.
Yeah.
So nice gentle punching just out in front. That's the way. Good. So the good combination of these exercises, the fact we're doing some aerobic work and anaerobic work, the anaerobic work being the weights that we're doing, the resistance training, combination of those put into a program every day, and it could be as little as going for a 30-minute walk most days of the week or every day of the week. 30 minutes at least, building up towards an hour would be a really good steady way of approaching it. And as I said before, it can be as little as walking the dog. It doesn't have to be 30 minutes all in one block. You can stage it out throughout the day. But it should be 30 minutes at least in addition to what you would normally do in a day. So we're trying to just progress things along. Mm-hmm. So if you can maintain that and you can follow your healthy eating tips, doing that 5 times a week, 30 minutes at least a day, will aid in reduction of weight, which is obviously going to be more motivational for you as well. It's going to put less strain on the heart. You're going to get a loss of body fat and build a skeletal muscle. So it's all about creating a healthier system. So if exercise for you and doing this sort of exercise isn't appropriate or you can't tolerate it, then I really like things like getting in the pool, as I mentioned earlier, and doing some just gentle work in the pool. Mm-hmm. Your heart rate's different in the pool than what it is on land, so you shouldn't be aiming for the same heart rate zones, about 20 beats per minute less. Oh. You'll get about the same exertion.
Right.
Okay. Exercise bikes are great for people that have got knee pain, joint pain, arthritis pain. The circular motion of the exercise bike will actually help to nourish the joints. So it's actually really good for arthritis as well. And if getting out on a bike on the streets isn't right for you, then an exercise bike is exactly right. But if you've got things that are specific to you, injuries, other illnesses or ailments, really important thing to go and check with a health professional such as your doctor, your physio, your exercise physiologist. Okay,
right. Yep.
So follow through with any of those tips. Healthier lifestyle awaits, all right?
Fantastic.
So last one for the lower limbs is going to be your quads and your glutes. So we did sit to stands before. Feet just a bit wider than shoulder width apart. And all I want you to do is try not to have your knees coming in or out, but going straight down into a semi-squat and then back up. So you have your hands just on your hips. So sometimes the elements are against you and you can't get out and have a nice walk. Might be as simple as getting down to the shops and walking up and down in the shopping centre for a while and then stopping and having your cup of tea afterwards. But it's all about trying to find the right environment that you can do that little bit of extra work than what you'd been doing previously or what you would anticipate needing to do on any day.
Good.
But before entering into any gym-based program, it's always good to get some recommendations from, again, a health professional. How's that feeling?
Feeling good, thank you.
Okay. About that, just gentle jogging on the spot. It's always a nice way to finish off with a gentle jog. So our heart rate's been elevated during the session. What we want to do as part of a cool down is try and get you back down to a resting heart rate. So I'll ease down in the jogging. So stopping too quickly can have detrimental effects on the muscles as well. Get really tight, tired muscles. Need to be cooled down appropriately. So we'll just really slow everything right down. The temptation is that we can be a bit time poor. You've done your exercise, you just want to pull the pin,
Right.
Go and sit on the couch. Really important just to take your time and make sure that not just for your heart, that you're recovering your heart rate, but for your muscles as well, that you're just taking the time to make sure that you are properly rested and recovered after exercise. So we've done a lot of work with our arms and legs. It's important that we do all the appropriate cool down for each of those as well. So while you're walking, you can do things like just rotate your shoulders through, going backwards and then forwards. Might just even be stretching your arms and having a bit of a movement of your arms while you're walking still. This is just one example being sort of in this environment and walking around, but it might be mapping out your route that you'd walk around the block and just saying, well, for this bit I'm going to be pushing at this rate. I'm going to try and go a little bit harder here. Look at what my heart rate is, look at what I'm perceiving my exertion to be, and then by the end of this block I want to just ease back and walk back nice and slowly, stop at the end, do some stretches, then go and get a drink. So we'll go on and do some stretches like we did at the start, just to cool back down again. We'll work from the bottom up this time. So what we'll do is we'll start off by doing some calf stretches. So remember those train tracks. So you don't need to be on a tightrope for this stuff. There's many ways to stretch a lot of these muscle groups. So if you've been taught another way to do it, you can of course do it that way.
Mm-hmm.
It's got to be what's right for you. Okay, we'll go and do some stretches of your quads muscle. So again, support yourself with the chair, because you're just going to lift that one foot up. Try and keep your knee next to the other knee or as close as you can to it. If you're having trouble with getting your foot up into this position, some people will have trouble getting your foot up into that position, you can actually assist yourself with a chair. and actually just have your foot up on the chair,
Okay.
like that. And even in that situation there, I'm still going to get a stretch in my quads as long as I'm reaching forward.
Mm-hmm.
Okay, so pushing the hips forward helps to get that stretch. Now change legs. And just to reiterate, we'd be going for stretches of at least 20 seconds, okay? Into a gentle stretch, not into pain.
Mm-hmm.
Yep. Got it?
Got that.
So maybe try with the
I might need that.
foot on the chair just as an
Reason?
alternative. Because then you're getting that without that reaching back to start with. Good. Also remembering to breathe while we do the stretches. Okay. We're going to be doing the hamstring stretch, so just one foot forward on the heel, feet shoulder width apart still. You can have your hands on your hip wherever it's comfortable, and just gently leaning until you feel that stretch down the back of the leg. Well, and then the other leg. Okay, and the last one of the lower limb, just going to get down on the floor again. Just do our groin muscles. It's feet together for as much as you can. Elbows in at the knees, and then just a gentle push down towards the ground so the knees are just directed straight down in that direction. How are you going? You got any questions or anything?
No, it sounds
going
it's
all
all
right?
good.
Good. It's always good to ask questions.
Feel it doing me good.
Excellent, excellent. So I'll get up and we'll just do the last few of the upper limb. So to start with, again with the biceps, so hand, palm up, out in front, hand over the front, and to increase the stretch, just bring the arm down if you need to.
Still 20 seconds minimum.
20 seconds minimum. Just to gentle discomfort. We don't want pain. As physios, we don't mind discomfort, but not pain.
Right.
And then shake that out, and the other arm. Good. And then the tricep one, where you just bring your arm down your back and just pushing straight back down. And then the other arm. This is quite a prescriptive warm down. It's sort of very, do this, do that sort of stretch. Just cooling down is important. So if it's a walk, if it's just shaking your arms out and making sure that everything's just nice and supple and not getting tight and sore, it's a really good start. Mm-hmm. So that sort of stuff. And the last one was just with your arm coming across your body and just pulling in with your wrist. And the other arm. How are you feeling? Breathing's recovered?
Breathing's fine.
Let's have a look at your heart rate just to finish off, just to see where we're at. So you found it straight away, just straight down from the thumb in that little groove.
Yep.
So we'll just go for 30 seconds again now. And stop.
42.
42, so it's back to 84 beats per minute.
Right.
Okay, so just doubling that gives you, you can count it out for the full minute. You can do any way that you can get to that sort of count, but 84 beats per minute. Get you back down to a resting heart rate. If it takes longer to do the cool down, then take longer. We just want you to get right back to that resting heart rate before sort of calling the session to an end.
Right.
All right?
No worries.
So hope you got a couple of tips out of that.
I did, thank you very much.
Moderate amount of exercise at a safe training rate with technique being the most paramount thing that you can do. If you start feeling nauseous, dizzy, any sort of cardiac symptoms of chest pain, arm pain, jaw pain, straight away just bring it to a bit of a halt and make sure you raise some alert at that point. Okay?
Good, thank you
Great.
very much.
Thank you. So that was a general summary of some exercise tips that you can take with you, and you can feel free to use that as often as you can tolerate. It'd be great if you could do some exercises 5 or more times a week of a duration of 30 to 60 minutes. It doesn't have to be this set of exercises. This is very much a guide for you. If you could change that up with some exercises such as walking around the block, getting on an exercise bike, going to the local pool and just doing some gentle cardiac work, that's all going to do you a great deal of benefit. If you have any queries along the way, seek your assistance from your health professionals and they'll head you in the right direction. Enjoy your exercise.